2, 1. Good morning, good afternoon, and good evening, everybody. Welcome to day 2 of TMF Week 2025. Today is all about TMF standards, and we're so happy to have you here for day 2 of this wonderful conference. Just to get things started, just wanted to see if you guys can hear and see me. So if you can, just go into the chat, tell us where you're dialing in from. Actually, better yet, why don't you guys tell me what is your favorite TV show? What are you watching currently now? If you could add that into the chat, just let us know because I'm looking for new shows. Hint, hint, hint. So if you guys can just like put that in there, that would be really great. And we will start getting the party started. So if anybody has any recommendation for good TV shows, please put them in the chat. So I see there's some people from North Carolina. Somebody says Sirens, Spain. Somebody's rewatching Brooklyn Nine-Nine. Love that. Love that show. Blacklist. Watching Blacklist. South Carolina. We have some people from Italy, Philadelphia. Okay, so I'm getting some good vibes here. And also, thank you for the recommendation for TV shows. Now that we've got the fun start, I'm just gonna move on to some housekeeping rules. So just so that you know, all sessions are going to be recorded. So you don't have to worry if you miss anything, you can go back to it afterwards. It's not a big deal. But just so that you know, the recordings will be made available after the conference. So not after the session, but after the conference. So sometime next week, you guys will be able to have access to it. All attendees will receive a certificate of attendance. So you'll be able to show off what you learn on LinkedIn, kind of brag and say, like, I was at the TMF Week 2025 conference, best TMF online free conference on the planet. So you'll be able to do that. And questions will be answered after the presentation. So if you have any burning questions, I will direct you to the right side of your screen. That is the engagement panel. So you see that there's chat, there's the Q&A section. You can either put in your questions in there or in the Q&A section. Also, you can download the presentation. That's where the Docs tab is. So if you guys want to reference it afterwards, you can do that. And networking breaks will follow each session. So after this session, there will be a networking break. And we encourage you to go and mingle with peers, get to know each other. We're part of a community. So, let's get to know each other. Let's get to share ideas and do all of those great things together. And we also encourage you to ask questions as well, because again, this is what TMF Week is all about. It's about learning. So just going over the session timeline. So we're going to have our session with Paul Fenton Carter for about 30 minutes. And then after that, we're going to have the Q&A section for 15 minutes, and we'll introduce the next session. And then there will be another networking break. So without further ado, I'm going to pass the mic over to Paul Fenton Carter, our CEO and also chair of the CDISC TMF Reference Model Steering Committee. And he will be talking about the CDISC TMF Reference Model, the vision, the roadmap, all that good jazz. So I'm going to hand that over to you, Paul. And here we go.
Thank you, Kim. I love that introduction. I'm really interested in some of those shows as well. I'll be taking notes. So thank you, everybody, for joining today's session. My goal today is really to give you an update in terms of where we're at with the CDISC TMF reference model, but more importantly, communicate the vision that we have moving forward, and also talk about the roadmap of the various different initiatives that we plan to undertake over the next 3 to 4 years. So for those of you who don't know me, I'm Paul Fenton Carter. I have been on the TMF Reference Model Steering Committee since pretty much the beginning, and have been very involved in a lot of the different initiatives, notably around sort of standardization. So it's with great pleasure that I communicate our vision as a reference model community moving forward. So over the last sort of 6 months or so, the steering committee has been meeting to actually come up with clear roadmap in terms of where we need to go as a standard. And we've also put together our vision. And the first thing in our vision is digital first. So we're really trying to develop the first digital TMF standard, which will be released at the beginning of 2027. And this standard is an evolution, obviously, of the current TMF reference model. But the difference is that we're really thinking about digital information. So we're thinking about things like metadata. We're thinking about interoperability with other systems. And we're really sort of moving away from the traditional sort of paper thinking, which is, what was in place at the time when the reference model was first born, right? It was very much paper TMFs at the time, and moving much more towards a digital standard. The next thing that we're thinking about is harmonization across all of the different types of studies and trials. So up until now, obviously the reference model has really been focused on interventional drug trials, like traditional interventional drug trials. And there has in the past been efforts to try and include aspects of ISF, so identifying which artifacts from the sponsor or records from the sponsor should also be present within the ISF. There's also been a certain amount of work done around medical device, and we saw the issuance of a first version of a real-world evidence or non-interventional study reference model as well last year. But what we're doing with V4 is we're looking at all of these different areas, and we're trying to make sure that they're all part and parcel of the same standard. And that's very important. And so there's a lot of different work groups that have been set up to handle all of these different things and make sure that everything is harmonized. We're also moving towards becoming a governed standard. So as you know, the TMF reference model was born by a very motivated group of volunteers who wanted to do things better. Before the reference model, everything was really just very ad hoc, and each company organized their TMFs as they saw fit. The problem with that is that there was so much variability. It became very difficult to manage, when you were sort of working with CROs or between sponsors, but more importantly, it was also very, very often time-consuming and even confusing for inspectors. And so the TMF reference model did bring about a certain amount of standardization. Although it's never been a formal standard, it's always been an ad hoc standard. And I believe that today the vast majority of organizations use the reference model to organize their TMF, and the inspectors are used to seeing things organized by the TMF reference model structure. So it's already quite an achievement that we've managed to do that as a community, and that we have this de facto standard, but now we're moving into having a governed standard where we have very structured processes, which CDISC is really giving us. Being part of CDISC is definitely allowing us to go to the next level. But also, as we start to grow the reference model and expand into different areas and add on metadata and things like that, the reference model is also becoming much more complex and larger. And so we need to make sure that we're able to properly govern it. And that's why being part of CDISC is so important, and making sure that we have the proper processes in place to manage this standard moving forward is key. Now, the TMF reference model was built by the community and for the community, and it's still very much community driven. We have a lot of volunteers who get involved in lots of different aspects of Trial Master File and the development of the TMF standards, and that's really great. That's why we're so successful. It's because of the community, and we'll continue to give back to the community as well. And so things like training are still very, very important, and sort of onboarding, new TMFers into the community is also very important. and just having that community to be able to ask questions. A lot of times people will say, well, what do you think about this? Where do you file this, etc. The community is there to answer those questions as well. And so the community will continue to be a very, very strong part of the TMF reference model as it moves forward to becoming a digital standard. Now, the interoperability and integration is also very important. As we know nowadays, there are many, many different clinical systems and also many organizations that are involved in clinical trials and clinical studies. And a lot of the information that's required for the trial master file exists in other systems and within other organizations. And so it's very important that we develop a standard that is built for interoperability. And so this is where we're looking to align with initiatives such as digital data flow and USDM to be able to make it easier to interact with these systems and organizations and provide a much more holistic view on the trial master file. We're also looking at the way that we organize information. So obviously, as I said earlier, that when the TMF reference model was first conceived, it was built around paper, and it was built around filing rooms, and it was built around binders of paper and information, which is very sort of functional in nature. And so we had, the different functional areas of the organization, and those translated into process zones, so like data management, and biostats, and regulatory, and clinical. And so, at the time it made sense. But today we need to think more about processes, clinical processes, because obviously the trial master file is telling the story of the study, and the study is made up of many, many different activities. The story of the study is made up of many activities and processes. So we need to think about how do we connect things together, and then also how do we leverage data to tell a better story. So these are things that we're also thinking very carefully about. And then finally, our ultimate goal is to gain recognition from the regulators. So have the regulators say, we want you to use the CDISC TMF reference model standard as the standard for organizing and presenting information within your trial master files. And this is an important goal. And it's a goal that we've had for a very long time. But we feel that the only way of actually achieving this goal is obviously becoming a formal standard, number one, which is formally governed and managed, but also by having dialogue and interaction with the regulators and having regular interaction to get their opinion and show them what we're doing. And ultimately they are a stakeholder in all of this, and so it's very important that they have a seat at the table as well. As we move this forward, and I feel that there is interest within the regulators in what we're doing, and so I'm fairly confident that over time we're going to be able to move towards recognition. So that really is the key 6 areas that we're focusing on as part of our vision moving forward. I'd now like to talk a little bit about our roadmap. So this slide is obviously very difficult to read, and I'm not expecting you to read it because I'm actually going to give you an overview in the following slides of what each of these different areas are. But just to talk about this, we as a steering committee have met and sort of identified a whole series of different initiatives that we plan to undertake or are already undertaking based on feedback that we've received from the community over the last few years. And so this roadmap is a living thing. Obviously, it will evolve over time, and it will be published in the coming weeks on the CDISC website, so that you can consult it and look at it and understand it. But I'm going to go through some of the key areas of this roadmap, which will give you an idea of some of the things that we're going to be working on. And if you want to get involved, obviously, in these things, you should definitely reach out to us and register as a volunteer on the CDISC website. So the first thing within our roadmap is core standard development. So this is really the bulk of the activity that we're currently working on today. And this is really taking the reference model as it exists today so the Excel spreadsheet that we all know and love, and transforming that into a digital standard. And so one of the things that we're doing is looking at sub-artifacts. So right now there are a whole bunch of different sub-artifacts. I think there's over 600 that have been defined within the reference model, but these today are informal. They're just really a recommendation. You know, if you're going to manage this kind of record, well, this is the sub-artifact and the associated artifact. We need to move away from that informality. We actually need to formalize the sub-artifacts, and what we're going to do is we're going to convert them into record types. And the term record type is being used specifically because we're aligning with ICH E6R3 that talks about essential records. And so in the future, we're going to have a list of record types that is really central to the TMF reference model. And we may end up with around 800-900 record types. It's quite possible. And these record types will have a series of different attributes and will also be grouped by record group. So we're moving away from the term artifact, and we're going to be creating record groups. And so these record groups will allow us to visualize record types across processors. And so, for example, we may have a record group which relates to protocol. And within that record group, we're going to have a whole bunch of different record types, such as the protocol itself, of course, but then also protocol amendments, protocol signature pages, even though these record types may live in different process zones today. But we'll be able to group all of these things together using record groups. And so it'll make it easier to see related records together. We will also be aligning with ICH E6R3. So as you probably started to see, within ICH E6R3, there's Appendix C, which talks about essential records. And it has sort of two key parts to it. There's one part which gives us criteria for determining whether something is an essential record or not. And then the other part is basically two tables with listings of different record types that are expected. And it goes much further than ICH E6R2 does. And so what we're doing is we're looking at that very closely to make sure that we're using the same terminology, that we're covering exactly what's required in ICH E6R3. We're also looking at the body of the guidance. So throughout the guidance, there are references to various different records, essential records, and so we're also making sure that we align with that and that we're aligning with the terminology. There's also a group working on control terminology. So all standards within CDISC are encoded using control terminology, and there's a library of control terminology that is maintained by CDISC. The control terminology project is run by the NCI EVS group, and so they do a great job, and they've already started to encode the TMF reference model using control terminology. This will be very important for the future because we want to be able to use the same terms as everyone else in other areas within other clinical systems are using, but also we want to be able to understand information that we're receiving from other systems as well. And so making sure that everything is encoded is very important. So those are really the key things that we're focusing on when it comes to core standard development. The next area that we're focusing a lot on within V4 is digital TMF metadata standards and interoperability. So as you know today, the TMF reference model spreadsheet is primarily an organizational structure. There are a certain number of metadata that are present, notably to be able to describe, for example, the level of a particular artifact. But there's actually a lot more that we can do here. Within the exchange mechanism standard, we already defined a set of metadata fields that could be used to describe artifacts. What we want to do with V4 is we want to go a little bit further, and we want to make sure that we're able to cover all of the metadata that's required from a TMF reference model standards perspective. So being able to describe all of the various different record types, their description, their levels, etc. But also provide a subset of operational metadata which is specific to different record types. So for example, if you have record types that relate to IMP, maybe you'll have a metadata field which is batch number. If you have record types relating to informed consent, well, maybe we'll have a metadata field consent type. So there are obviously many different pieces of metadata that we could define for different record types. For the initial release, we're going to sort of try and limit it to the most important subset, but it will evolve over time. At the same time, when we're defining this metadata, we will also be aligning the metadata labels and values to USDM. So USDM, if you're in the previous session, you'll know all about it. It's the Unified Study Definition Model, which basically gives us a whole set of metadata that's already been defined to describe study design and things like that. So if a piece of metadata already exists in USDM, well, we're going to align to it, because it will allow us then to improve our chances of a more seamless interoperability with other systems that are also using USDM in the future. All of our metadata will also be encoded using control terminology, and there'll also be, for certain pieces of metadata, standard code lists, so value lists that will also be defined within control terminology. And then finally, we're also looking at audit trail. So obviously, within 21 CFR Part 11 and Annex 11, there's a very well-defined criteria for audit trail. So creation, modification, deletion of records. But we do see within TMF that there's an expectation from inspectors to see more. They want to see who got involved in uploading a record, for example, who indexed it, who reviewed it, what oversight was done, if it was approved, who approved it. So this kind of information also needs to be encapsulated. And so we're looking at ways where we can maybe provide a standard for that as well. So it makes it easier, number one, to understand the audit trail, but also makes it easier when we're doing things like migrations. So that's also important. Now, the third area that we're focusing on is what we're calling ancillary standards and mappings. And so as I mentioned in our vision, we're looking at a broader scope where we want to sort of make sure that we're covering things like medical device, RWE, etc. And so we have a series of working groups that have been put in place, or that will be put in place, to start to focus on these areas. Now, one of the areas that we want to look at is ICH M11, and we already have a team that's being put in place for that, where we're looking at the digital protocol standard, as well as USDM, of course. And our intention is to map all of our record types to ICH M11. So all of the various different sections and subsections of the digital protocol will be mapped to the various different related record types. So for example, if I'm looking at the randomization section of the digital protocol, well, I will see all of the record types that relate to randomization. If I'm looking at IMP management, I'm going to see all of the record types related to IMP management. If I'm looking at monitoring, I'm going to see all the record types related to monitoring. So it will make it easier for us to be able to navigate the TMF by digital protocol. So that's one thing that we're doing in the next year or so, is starting to look at that as ICH M11 becomes final. We're also about to do a public release of the first revision of the ISF reference model. Now, the ISF reference model has been developed over the last year or year and a half, and the next session today is about the ISF reference model. And this is pretty significant because up until now, there have been several different models that have existed for ISF, so investigator site files. But this new model, which is part of CDISC, and has been developed by around 50 individuals from clinical sites as well as from vendors and sponsors, has taken all of those various different models and brought them all together to come up with one single model. And this model covers not only the records that are provided to sites by the sponsors, but also the records that are generated by the sites. And so it really gives us a full ISF. And the hope is that this will be adopted globally by all of the various different sites, as the TMF reference model has been adopted by sponsors, so that we have really a very standardized approach to ISF. Now, in the second revision of the ISF reference model, we'll be focusing on how we align it and integrate it into V4 of the TMF reference model. So there will be some changes. We'll be moving to things like record types within the ISF reference model as well. And we want to make sure that it's part and parcel of the same standard. In the same vein, we also have the RWE group, or non-interventional studies group, that put in place a first version of a reference model for RWE, which has started to be used within the industry, and that group is now regrouping to start to work on the next release of that reference model. And the RWE reference model revision 2 will also be part and parcel of the overall TMF reference model version 4. So again, it's going to have things like metadata standards, it's going to be digital, and fully aligned. We are about to restart the medical device team as well. So there was already some work done in the past around medical device, but now our goal is really to come up with a full medical device reference model standard, which covers all aspects of medical device. Today, I think we cover some aspects, but it's not really complete. And so that's a very important initiative as well that's about to start. So if any of you on the line are medical device experts, please feel free to volunteer for that sub team, because I think the more experts we can have, the better, to come up with something that really makes sense for the overall medical device picture. And then finally, we also have a team that's starting this week that is focusing on computerized systems. When we look at ICH E6L3, there's a lot of reference to computerized systems, and obviously we're using many more computerized systems today within clinical trials. And so it's very important that we recognize the requirements from a TMF standpoint in terms of CSV, and also how we sort of interface with system level documentation, for example, during an inspection. So that group is really looking at the full gamut, not just on validation, but also all of the other records that are generated around computerized systems, so that we're able to better meet today's requirements. We will also be working closely with CDISC to develop new tools for the management of the reference model as it moves into its digital form. So we'll be developing a series of requirements to define a database type tool that we require to be able to manage this sort of expanded reference model and all of the associated metadata. And so we'll be putting together those requirements as a sub team. So if you're interested in that, again, please volunteer. Once we've got those requirements pulled together, we'll actually work with CDISC to determine whether we need to build a new tool, or whether we can use existing tools that exist within CDISC to be able to host the reference model, the digital reference model. And once we've got that tool built and tested, obviously we'll then migrate in version 4 once it's ready. We'll also, in the future, be thinking about things like APIs to be able to interact with this tool, and have systems be able to query this tool to be able to understand the information that they're looking at. And then finally, there'll also be an updated implementation guide. So we'll be writing a TMF implementation guide, which will explain how to use the new digital standard, all of the different conventions, etc. So it'll be a very useful document, and of course we'll also be providing training on that. And then finally, the last area that we have within our roadmap is training, guidance, and frameworks. So we've been working with the training team to put together a fairly comprehensive training program that we want to roll out over the next 2 years. And so we will be providing more details on that soon. But training is a real core part of what we do as a reference model community. And as we move towards this new standard, training is going to become very critical to make sure that everybody understands how this works and how to implement it. We'll also be enhancing our risk framework. So we recently released the first version of the risk framework, and we're hoping that organizations will start to use this now. But we know that it's not complete. We know that there are other aspects that we need to integrate into this. And so this will be an ongoing effort. We'll also be updating all of our conventions. So there's a whole bunch of different conventions for things like dates, for example, that we'll be reviewing and updating ready for V4. We'll also be updating our TMF plan template. So the TMF plan template will need to start to integrate some of these digital concepts as well. And so we'll be updating that. And then finally, regulator engagement. So I mentioned this at the end of the vision talk. Regulator engagement is super important. We've already started to reach out, and CDISC really puts us in a good position as well, because CDISC has a lot of the relationships with the regulators across the globe. And so making sure that we have sort of key points of contact, and that we bring those points of contact up to date in terms of what we're doing, and we get their input in terms of what they would like to see as stakeholders and consumers of our TMF, is really key. And so we will continue on creating bridges with the regulators and having dialogue with the regulators, so that we can achieve our ultimate goal of getting recognition, formal recognition from them. So with that, I am going to say thank you all for listening. I hope that was informative and gives you an idea of where we're going with the TMF reference model. And I will now open it up to questions.
Thank you very much, Paul. And this was very, very informative information for people. And I love the fact that we're asking for people to volunteer. We added a couple of links. I also want to give a shout out to Lisa McAllister. She also put in the link as well. And people in the chat just like talking with each other and asking questions, and people answering as well. So thank you so much. Like I said, we're part of a community, and everybody is invited to participate and volunteer to make sure that our community strives and is better. So there are a lot of questions that came in. Yeah. So I am going to share one. One is from Usman, and I'm going to share that here. What are the biggest gaps in the current TMF reference model that a digital-first approach aims to address?
So I think today one of the biggest, I would say, challenges in the reference model is the fact that we have informal sub-artifacts, and that also we don't necessarily always have consistency across the different process zones. And so I think we're really, with this new digital reference model, we're trying to sort of tighten that up. And basically, because this will become a formal standard, we're going to be able to achieve better consistency across sponsors, across TMFs, in terms of how we're calling things, how we're describing things. So I think that's definitely a very important evolution, having this formal record type rather than informal sub-artifacts and then artifacts. I think also one of the big challenges we have today, often we migrate TMFs from one organization to another. So, the typical scenario is CRO to sponsor at the end of the study. And because we don't necessarily have a formal metadata standard, each sponsor has their own metadata, or quite often each system vendor has their own metadata. And so we do a lot of mapping to try and import the TMF into the target system, because obviously when we think about records, there's the files themselves, right? So the documents, the PDFs, the data sets, whatever they are, but there's also the metadata that goes with it, and the audit trail, right? So we need to have standards for these things as well to make it easier for us to move information around. And if we think further along, if we want to be in an environment where we're much more interoperable with other systems that are also holding TMF relevant records, if we're sharing the same metadata standards, because we're aligning also with USDM, it's going to be a lot easier for us to move things around, or even for us just to access records in situ, rather than sort of taking copies and uploading them and then trying to manage those copies. So I think that there's definitely a lot of benefits to having a digital first approach. And I think it's definitely quite an evolution when it comes to the reference model, which is why it's also taking so long, right? It's only going to be released at the beginning of 2027, and so there's a lot of thought going on right now to work out, okay, well, how do we move this to a digital standard, and what's the impact? Because obviously we have to be very careful about the impact as well on the industry, and making sure that the industry is able to adopt it. So,
excellent. Thank you very much for the answer, Paul. I'm going to share a question from Olivier Petit that our interoperability is also a problem for commercial, for MA with related documents, transfers, etc. Will those aspects be taken into account for defining interoperability standards, or the scope will be R&D and under I&D?
Yeah, so for the TMF reference model, obviously we're very much in the R&D space. Although merger and acquisition is a very real situation for a lot of our companies, right? We're either being acquired or we're acquiring, and so quite often we have to be able to move things around, as we integrate entities that we've acquired. So having data interoperability and standards is going to make it easier to do that. But I think that this question relates more to the sort of the bigger picture, and I think that that's where we need to start to look at digital data flow and interoperability as defined by digital data flow, because digital data flow is really looking at a much more broader scope. So I would recommend going to the Transcelerate website, looking at the digital data flow webpage. It's got a lot of information on there, and also look at the USDM page on the CDISC website, because it's starting to talk about the scope and the future scope. And so I'm pretty sure that they're going to start to look at the commercial aspect as well.
Great. Thank you for that. I have a question from Jess Green. I'm sharing this here. With all the work put into defining the terminology so specifically, is there any expectation for eTMF providers to provide more support in signposting this to end users? And then she gives an example when the metadata field is aligned to USDM standard, and users training is only one method to communicate this, and greater eTMF UI support would be appreciated.
Yeah. So So it's a great question, and definitely the vendors are playing a very important role in this whole exercise. So we have a vendor sub-team that meets regularly and talks about all of these different things. And the vendor sub-team have also started to put together all of their existing metadata standards that they've defined within their systems. And they're trying to put it all together so that they can come out with a baseline metadata standard. Once they do that, then they'll start to look at things like USDM and say, okay, well, in our baseline, we call it this way. How do they call it in USDM? Or does it exist in USDM? And if so, how do they call it? So that we can make sure that we have alignment there. Afterwards, I think in terms of training, obviously the implementation of the digital standard is going to be up to the vendors. But I do feel that the vendors will definitely have to do a fair amount of training from a change management standpoint as they start to release versions of the systems which are aligned to the new version of the digital TMF reference model standard. And so I think training definitely is going to be super key from the vendor standpoint, but also from the reference model standpoint. So we'll be putting in place training programs which cover things like metadata, for example, and how it was implemented. And I'm pretty sure that in our system that I was talking about, where we're going to be storing the reference model, you'll be able to see links to USDM. So you'll be able to see, okay, well, this piece of metadata is part of the USDM standard, and the standard list of values for this metadata also come from USDM. So for example, if you have like a metadata which is study phase, well, study phase is a standard USDM metadata, and it has a standard list of values which gives you all of the different phases, phase 1, phase 2, phase 3, etc. So we would be aligned if we needed to have that piece of metadata within the reference model. We would use the metadata that was defined within USDM, and you would be able to see that through the online tool for being able to search and understand the reference model.
Excellent. I am going to move on to next question, which is from you, Sven, and it's about AI. Always a popular question when we're talking about AI. It's everywhere. How can AI and automation enhance TMF quality control, inspection readiness, and real-time monitoring?
So that's a huge question, and I could probably spend the whole morning answering that. But I think we're really just at the beginning. So we've started to look at AI within TMF management over the last I'd say 4 years, and the big focus has really been on sort of indexing, identifying record types, extracting metadata, and maybe performing some basic sort of Alcoa type checks. If it says that I should have 9 pages, do I have 9 pages? If this is meant to be signed, has it been signed? I think we can go much further. I think that the big ticket items when it comes to AI and TMF is things like risk detection, risk management, detecting anomalies across records, those kinds of things. But I don't think we're there yet. I think that that's coming in the future. How does that relate to the reference model? I think that the fact that we are going towards a formal digital standard with a much richer metadata set is going to help us implement sort of more sophisticated AI models. So I definitely feel the standardization is a big contributor to sort of leveraging more from AI in the future. But I still feel that we're not there yet. And I think there's a lot of neat things happening in AI, but also AI is only as good as your data. And it's a bit to understand your data. And so that's why we need to have much more structure and much more standardization for us to truly leverage AI for some of these things. That's just my 2 cents. Yeah.
Excellent. Thank you so much, Paul, for the wonderful presentation. There was a lot to unpack, and I think a lot of people were definitely getting a lot of information, and also like the urge to kind of find out more of how this can help them, and also if they can be able to volunteer and help make it better. I also included the USDM CDISC link, so if anybody wants to go in there, they can check that out. Thank you so much, Paul, and thank you to all of the attendees with all your great questions and all of your engagement in the chat. I just wanted to let you know that the next session will start in about 15 minutes, and it's with Matt Lowry and Aaron Knight, and they're going to be talking about the ISF reference model, like the V1, talking a little bit about what's going on there, and I guess the vision as well, and also what is new. So I hope that you guys all come in and join that session. That being said, it's time to have a network break. It's time to meet up and have a conversation. Share ideas, and just like go to the lounge and have fun and meet new people and build your connection that way. Remember, it's a community. We want everyone to, come together. And with that, I'd like to say thank you to everyone. And Paul, again, that's all.
Thank you. Thanks, Kim.
Thank you very much. You're welcome.
Thank you.
Bye, everybody. Bye.